The U.S. House of Representatives has passed the controversial One Big Beautiful Bill Act. A sweeping budget reconciliation measure will drastically reduce access to health care for millions of immigrants, including thousands of Jamaican Green Card holders. The bill proposes to delay or eliminate health care subsidies for lawfully present immigrants, impose penalties on states that offer coverage to undocumented or vulnerable non-citizens, and erect new bureaucratic barriers for recent legal residents seeking coverage. Jamaican nationals holding U.S. green cards could face significant challenges accessing health coverage if when the One Big Beautiful Bill Act becomes law. The legislation, passed largely along partisan lines, proposes to eliminate or delay eligibility for federal premium tax credits for many lawfully present immigrants purchasing insurance on the Affordable Care Act marketplace, impose financial penalties on states that offer health coverage to undocumented immigrants and certain categories of lawfully present non-citizens, including children and humanitarian parolees, disqualify DACA recipients, and other vulnerable groups from receiving any insurance subsidies. Why this matters to Jamaicans in the U.S. For Jamaicans who have migrated legally to the United States and obtained green cards, many of whom are employed in low-wage sectors such as healthcare, hospitality, and construction, this bill poses a direct threat to their ability to access affordable medical care during their first 5 years in the U.S. Currently, green card holders who fall below the federal poverty line can receive subsidized health care coverage through the ACA's marketplace if they're ineligible for Medicaid due to their immigration status. The new bill would remove this safety net, leaving new LPRs in a 5-year coverage gap.
Read more at Jamaica Live.